Dear students, welcome you all. Dear student, our today topic of discussion is polyene antibiotics. In our previous lecture, we were discuss about elimination and azole, a class of antifungal drugs which act on the cell membrane of the fungus. But in today's lecture, we will discuss about the polyene antibiotics. So, what is polyene antibiotics? Polyene antibiotic is a type of antibiotic which have many double bonds, and these double bonds are responsible for the antifungal activity of the polyene antibiotic. If you people focus on the meaning of the polyene antibiotic, so poly mean many and en mean double bond. So polyene antibiotic have many double bonds, and these double bonds are responsible for the antifungal activity of the polyene antibiotics. So that's the general introduction of the polyene antibiotics. Now move forward toward the example of the polyene antibiotics. So the example of polyene antibiotics is amphotericin B, nystatin, and neomycin. But in today's tutorial, we will discuss just only about the amphotericin B. So what is amphotericin B? Amphotericin B is a naturally occurring polyene antibiotics which is obtained from the Streptomyces nodosus. So amphotericin B is a polyene antibiotic and naturally occurring polyene antibiotic obtained from the Streptomyces nodosus and having many double bond which is responsible for its antifungal activity. This amphotericin B have many double bond which is responsible for its antifungal activity, or we people can say that amphotericin B have many double bond, and due to this many double bond it have a antifungal activity. Our amphotericin B have antifungal activity due to many double bond which is present in the structure of the amphotericin B, and fungistatic at low concentration and fungicidal at higher concentration. When we people use amphotericin B at low concentration, so it will act as a fungistatic, mean it will inhibit the growth of the fungi or it will stop the growth of the fungi. But if we people use it at a higher concentration, so it will act as a fungicidal. It means that it will kill the fungi completely, it will destroy the fungi completely. So that's the general introduction of the amphotericin B. Now move forward toward the spectrum of the amphotericin B. So antifungal spectrum of amphotericin B. So amphotericin B works against the following type of fungi: Candida albicans, Histoplasma capsulatum, Cryptococcus neoformans, Aspergillus, and Coccidium. So for this type of fungi, we can use the amphotericin B, or simply people can say that if an infection occur due to this type of fungi, so in this case we can administer the amphotericin B. So that's the antifungal spectrum of the amphotericin B. Move forward toward the mechanism of action of the amphotericin B, that how amphotericin B work against the fungi, how amphotericin B destroy the fungi or inhibit the growth of the fungi. So mechanism of action of the amphotericin B. Amphotericin B bind to the ergosterol and fungal cell membrane and form pores in the cell membrane. Cell contents leak out and leading to the death of the fungi. First of all, let's consider this is the amphotericin B antibiotic, or this is the molecule of the amphotericin B. So this drug is bind to the ergosterol, and this ergosterol is present in the fungal cell membrane. So when amphotericin B bind to the ergosterol and the fungal cell membrane, it form pores or hole in the cell membrane of the fungus. It form hole or pore in the fungal cell membrane. In the inner contents of the fungus leak out through these pores and leading to the death of the fungus. Let's consider this is the cell of the fungus. So the amphotericin B bind to the ergosterol. This is the ergosterol. Amphotericin bind to this ergosterol. You people can also see it in the microscopic diagram. So this is the cell membrane of the fungus, and this blue part is the ergosterol. This is the Polyene antibiotic or amphotericin B. So this amphotericin bind to the ergosterol and form pores or a hole in this cell membrane of the fungus. The white part which appear in this diagram is the pore which is produced by the Polyene antibiotic. So the inner contents of the fungus cell leak out to these pores, to these holes, and leading to the death of the fungus. So this is the mechanism of action of the Polyene antibiotic or amphotericin B. Now move forward toward the pharmacokinetics of the amphotericin B. So amphotericin B is insoluble in water, does not absorb orally because of its lipophilic part in its structure. So when we administer amphotericin B orally, so it will not absorb from the GIT. Why? Because of its lipophilic part in its structure. So because of its lipophilic part in its structure, it will not absorb from the GIT or from the gastrointestinal tract, thus effective only for fungi present in the lumen of the GIT. It will not absorb from the GIT, thus only effective when the fungi is present in the lumen of GIT. So in this case, we can use the amphotericin B. And for systemic infection, used through IV route, and when there is a systemic infection due to the fungi, so in this case we can use amphotericin B through IV route. Intrathecally for meningitis and locally for mycotic ulcer. In case of meningitis, we can administer the amphotericin B intrathecally, while in case of the mycotic ulcer, we can administer the amphotericin B locally. And for fungal arthritis, inject directly to the joint. If there is infection of joint, if there is arthritis due to the fungal infection, so in this case we can administer the amphotericin B directly into the joint through the injection. So this is the pharmacokinetics of the amphotericin B. The next topic is resistance to the amphotericin B. That how resistance are developed against the amphotericin B. So resistance are developed against amphotericin B due to decreased contents of the ergosterol. When there is a decrease in the contents of the ergosterol, so leading to the resistance against the amphotericin B. Why? Because amphotericin B bind to the ergosterol and form holes in the cell membrane, and the cell contents leak out from the cell and leading to the death of the fungus. So when there is a decrease in the ergosterol contents, leading to the resistance to the amphotericin B. So this is the pharmacokinetics and resistance of the amphotericin B. The next topic is ADR of the amphotericin B. So amphotericin B may produce fevers, chills, spasm, vomiting, headache, and hypotension. So these are the ADR or side effects of the amphotericin B. The next topic is the uses of the amphotericin B, that in which cases, in which condition we can use the amphotericin B, or for what types of disease we can administer the amphotericin B. So amphotericin B is used for the cystitis due to the candida. Cystitis is the inflammation of the urinary bladder. So when there is the inflammation of urinary bladder due to the candida, so in this case we can use the amphotericin B. And also use orally in fungal infection of the gut. When there is a fungal infection of the gastrointestinal tract, when there is a fungal infection of the gut, so in this case we can use amphotericin B orally. So these are the uses of the amphotericin B. The next topic is brands. So amphotericin B are available in the market by a name of Vicmycin, a vaginal cream or pessary, and a products of the GSK. So these are all about the amphotericin B. I hope people will enjoy and understand the lecture. Otherwise, if you people have any question regarding to the lecture, so you can ask me in the comment section. So thank you so much for giving me your useful time. Thanks.